Hello, class. My name is Gina Froelich, and today I will be discussing the complexities of the access and quality of healthcare services for women who are incarcerated in prisons in the United States. Prison is often referred to as a revolving door due to the fact that individuals have a high likelihood of repeatedly passing through this institution, which makes incarceration a very recurrent experience. The predisposing characteristic of gender plays a large role in the presence of barriers for women experiencing obstacles within the U.S. prison system. The number of women in the U.S. prison system continues to increase more and more every year. In the year of 1980, women only made up 4% of the total prison population, and then in the year of 2015, they made up 20% of the population. According to a report from the Prison Policy Initiative in 2018, there were approximately 220,000 women currently serving time in the U.S. prisons. Another important predisposing factor to analyze when looking at the population of women in prison is the mass amount of females who are in minority groups of different races and ethnicities. The number of female inmates in these groups is much higher than white females due to the fact that the imprisonment rate for minority women is 2 times higher than that of white women. Unfortunately, there is a clear presence of systemic and structural racism where many minority women are unable to attain a job or have proper access to healthcare services. When it comes to the physical health and well-being of women in prison, there is a stark difference in the prevalence of certain medical conditions and diseases among races. Disparities among races have been identified in areas such as rates of cardiovascular disease, diabetes, and certain types of cancers. There are many enabling characteristics that play a role as a determinant in the exponentially increasing rates of women imprisonment. There is a direct association between high levels of jail frequency and high levels of homelessness. Other characteristics that may lead to female imprisonment include not feeling safe in your living situation, high levels of stress, or poor mental health conditions. There are lots of cases where women commit crimes of poverty, such as stealing or committing fraud, due to the fact that they are struggling to support themselves or their families. They even commit crimes as minor as not having an up-to-date driver's license, and this will land them in jail due to this disadvantage. Things like homelessness and low socioeconomic status are major enabling characteristics for this special population. There is a huge mental health crisis breaking out in prisons throughout the country, with the percentages of prisoners with mental health issues increasing every single year. This crisis is especially profound among the population of women prisoners, as they have a disproportionately high level of physical and mental health issues. A study done by the United States Bureau of Justice Statistics stated that 75% of women incarcerated in both jails and prisons have a mental illness, compared to just 55% of the men. In the largest women's prison in the state of Oklahoma, 90% of the women prisoners are receiving some sort of mental health treatment. There's also a critical issue in the effect that prison has on one's mental health. Many women in prison have gone through traumatic life experiences, and the sad reality is that being in prison creates other consequences that make these symptoms even worse. For example, women could possibly lose custody of their children while serving jail time, and this is another traumatizing event that can affect their mental health. Along with these high levels of mental health issues among women in prison, there's also a very high prevalence of physical illnesses as well. According to the U.S. Crime Report, incarcerated females have higher rates of chronic medical disorders and higher rates of drug dependence than their male counterparts. These women in prison subsequently seek medical care and treatment 2.5 more times as often as male inmates. According to a study that was comprised of 327 incarcerated females, these inmates averaged 4 chronic medical conditions and received 5 medications on a daily basis. These women also had frequent histories of victimization, high rates of mental health issues, and challenges with negotiating proper health care. The testimonies of these older women have proven that there are many contradictions, dilemmas, and obstacles that they must face in order to obtain proper health care in prison. Consequently, there are many negative effects that these poor health statuses and lack of adequate health care services have on the female inmates in the long run. When these females are released from prison, they are at a disadvantage when competing with other civilians for housing opportunities and employment. Due to their poor health conditions, lack of proper nourishment, and barriers to healthcare services while incarcerated, many freed inmates are unable to maintain jobs that have any sort of physical or manual labor, which limits their job opportunities. Also, an important observation to be made is that this disadvantage of being homeless after being released from prison is that now they have a much higher chance of being incarcerated all over again, which proves the statement of prison being a revolving door, as the system is very cyclical. The need characteristics of this population are definitely hefty, and they will only keep growing if there is not serious improvements on a macro scale. Improving conditions for female inmates has been on the horizon and has become a larger focus of the Department of Justice. Although they have made an announcement that they allocated millions of dollars to implement programs to start meeting the needs of female inmates, none of these proposals have been made so far have had anything to do with actual healthcare services being delivered. These unresolved issues, combined with prison policies that are not informed by adequate research, may continue hindering the optimal healthcare from being delivered. There needs to be an increase in research, and an evaluation needs to be done of the complexities of these vulnerable populations in prison in order to adequately assess their needs and improve their quality of life while incarcerated, and also during their transition back into mainstream community. To wrap up this presentation today, I have come up with 2 discussion questions for you all to think about. First, it is evident that a very large majority of incarcerated females have a mental health illness, with an even higher rate in the population of minority inmates. Can you think of a fundamental alteration or improvement that can be made to the justice system so that women with mental illnesses are receiving proper health care first and foremost, rather than being locked into prison? Second, on any given day, U.S. state prisons are occupied by thousands and thousands of women who have extensive and communicable health ailments. Do you think that there's anything that the government can do to step in and ensure that these women are receiving adequate health care beyond their given right of reasonably adequate care? Thank you so much for listening to my presentation.